That's the best visual lesson I've ever seen on BRD and how antibody works. That's fantastic. Dr. Van Dyke, tell us, what are the product indications for Zactran?
Zactran is indicated for treatment of bovine respiratory disease due to Mannheimia, Pasteurella, Histophilus, and Mycoplasma. It's also indicated for control of bovine respiratory disease in cases of Mannheimia and Pasteurella.
Dr. Ulrichsen, what's the difference between treatment and control?
Well, treatment obviously is pretty self-explanatory. An animal's sick, you treat it. Control, you want to prevent the disease from affecting the animal in the first place. Example might be if you're bringing in some cattle that you may have come out of a stress situation, or commingled cattle, or you've had previous history where they've gotten sick, then you could use Zactran up front and prevent the disease from happening in the first place.
And Dr. Moravec, the video talked about how quick acting it is. Tell us about how fast Zactran goes to work and how long does it last within the animal?
Well, as you saw from the video, within 30 minutes, we're getting concentration that is a killing concentration, or bactericidal is the word that was used in the video, that will actually kill the bacteria that are there, and then it lasts for 10 days in that lung tissue. So it gets to the site of action very quickly, and within 24 hours you can see a positive response with that. Their temperatures coming back down to normal, and their improvement in their demeanor and getting back to the feed bunk.
That really is phenomenal. And Dr. Van Dyke, tell us a little bit about the overall safety of using Zactran.
Well, Zactran is safe. First off, it's also easy to use. It comes ready to use in a bottle that's well protected from breakage. It has very good syringeability in cold temperatures, which is really important to people this time of year. But most importantly, you worry about the safety of the animal. And in the safety trials, other than a few minor site reactions, there were no big adverse reactions at all in any of our studies. So it's a very safe drug to use.
And Dr. Moravec, the dosage, what do we give cattle?
It's 2 cc's per 110 pounds of body weight.
Very good.
Subcutaneously, in the neck, and if you have to exceed 10 cc's per that animal, make sure you follow BQA guidelines and make sure you don't give more than 10 cc's per injection site. Make sure they're at least a hand's breadth away from each other.
It's a great reminder. Dr. Ulrichsen, what would you offer in terms of some keys to success in using Zactran?
Well, I like Zactran especially because, first of all, it's a very powerful drug against BRD, the 4 pathogens that we have. And especially I like it's the hard hitting up front. Got a great kick from my experience when you've got a sick animal. You want to see that animal. I usually will take temperatures the first day, or have my clients take temperatures the first day, and I want to see that temperature heading down the next day. And I want to see that animal the next day feeling better, going up to the feed bunk, kind of monitoring, see how he's improving, and Zactran will do that.
That's fantastic. Now you can find out more about Zactran by visiting the website Zactran.com.